So this is TMJ protrusion, and then a protrusion with opening is a bit of a progression there using a McKinsey methodology or model. So for a lot of people that lack opening, in particular if you have an anterior closed lock disc scenario where we're very limited, maybe we have less than 2 knuckles or less than 20 millimeters of opening, because the classic test here is can you get 3 of your knuckles, barring you're that guy that like wins arm wrestling competitions, 3 of your knuckles in your mouth at any one point in time. So in this case, if you you follow McKinsey, we tend to lean on certain movements heavier than others, and the cervical spine or the lumbar spine. With the jaw, it tends to be protrusion. So protrusion is the lower jaw or the mandible moving underneath the maxilla, so just like this. And what we're gonna have Seth do is open his mouth slightly, so lips part, teeth part, push his jaw as high as he possibly can, and let it relax. So that would just be pure protrusion. He's gonna do a couple of these. Now, once somebody's progressed on this, and there may be clicking, there may be popping, there may be a little bit of pain, but now we want them to protrude as far as they can and then slam their mouth open as hard as they can. So it's more like a ballistic action here. So it's protrusion and then open. Now, Seth is gonna do a few bad reps here where he lets his upper C-spine go into extension as he opens. So we wanna try to keep him neutral. You can see we have him lying down, he's not seated. We have a pillow under his head. So if I took this pillow out, that's going to put him in a position where he's already extending his upper cervical spine, and that is the #1 compensation for mouth opening. So we want to take that away from him. So when we send people home with this, put them in neutral, start with protrusions, and then we add protrusion opening, and that would typically what we send them home with for 24 to 48 hours for lack of mouth opening, in particular if there's an actual disc issue in the TMJ.